In this video, we are talking about lower crossed syndrome. Lower cross syndrome is essentially a set of postural imbalances that can develop over time and can lead to lower back pain and hip pain. It's a very common cause of lower back pain and hip pain. Now, about a month ago, we did a video on upper cross syndrome, definitely worth checking out. And this is very similar to upper cross syndrome, but this one is called lower cross syndrome because it happens in the lower half of the body, but it's a similar pattern of muscle imbalances that we see. These muscle imbalances include tightness in the erector spinae in the lower back and tightness in the hip flexors, those are the muscles in the front of the hip. We also see weakness or inhibition of the glutes and weakness or inhibition of the abdominals. And when that happens, that changes the postural shape of the spine and the pelvis. We typically see something called an anterior pelvic tilt, where the pelvis tips forward and the spine rounds forward, giving it more of a lordosis. And like I said, this can commonly lead to lower back pain and hip pain. It can kind of just throw things off in general in the body. So when we see this, we want to make sure that we address the weakness in the muscles that we just discussed and the tightness in the other muscles as well. In future videos, so make sure you stay tuned, we are going to go over some of the best ways to stretch those tight muscles that are involved in lower cross syndrome and ways to strengthen the weak muscles that are involved. So if this sounds familiar to you, be sure to stay tuned for those videos that we have coming up. If this is leading to pain, if you have lower back pain, if you have hip pain, it's important to not ignore those signs or symptoms. We would be happy to help. Please visit us online at TruMotionTherapy.com to learn more or schedule an appointment.